Well, hi there, welcome back, and I welcome you specifically to get comfortable and let's do some chatting. I am Dr. Chung. I'm your friendly proctologist. Thank you so much for liking, subscribing, and commenting down below. It's helping this community to rapidly grow. Today I want to talk to you about a topic I hold near and dear to my heart, which is about pain. And I have no idea why, but the medical field in general has become very, very incompetent, compassionless when it comes to pain. If people only realize how bad pain can get in the way of people's quality of life, I mean, I think it would really change people's actions, right? And at least with their words, the patient can at least feel that they're being heard or being related to. Why is it that other physicians say, you know what, ibuprofen and you'll be fine, or they'll say hemorrhoid surgery, yeah, 2 days you'll be going back to work, you're gonna be all good. Why this misleading? Why not the honesty and prepare people for it? Why the ignored phone calls? Why don't we refill people's prescriptions? Why do we have people go to the ER because their pain is just so out of control, they've got no choice but to go wait in a waiting room for 4 hours just to get a little bit of pain medication and then go home? Why is the system so broken for people with pain medication? And I definitely feel for people for bottom end conditions specifically, because that's what I can talk about. Because if I ever need a hemorrhoid surgery, gosh darn it, I want my pain controlled, okay? And that's definitely what I do for my patients. You've got to teach people how to manage pain, how to use the medications to their advantage. That way they don't get hooked on the stuff. They know how to make sure that their recovery goes as smoothly as possible. It's very, very important in my opinion. And I remember one surgeon that I trained under, who was a trauma surgeon, Dr. Salzman. He is one of the funniest but inspirational, and he is super huge. I mean, this guy was so muscular, he could break my neck with his first and third finger. Okay, that's how huge this guy was. He was having some back issues, had some back surgery, and I remember he was, we were rounding together, working in the hospital late at night, and he said this to us. He said, you know what, you guys need to know that you guys suck. You guys are terrible at treating pain. You guys don't understand pain. And when I first heard that, I didn't know what that meant. I never had a pain issue, never had to suffer a day in my life in terms of that physical pain, and until now it still resonates in my head. And now that I've lived some life, treated some patients, heard some stories, grown some more emotional capacity, I now understand more what he's talking about. He's right. I suck at controlling pain, especially in the past. I remember in training, I would give pain medication, which was the standard stuff. It's a narcotic, but it sucks for hemorrhoid pain, for example. And we would, patients would suffer. And, I apologize for doing that. I am really sorry, because I know I would not want that done to myself. And so I just want to share two little stories here. And again, I am not here to dog on any specialty, because I just dogged on myself, okay? But these are some things that have been bothering me lately, and I don't understand why we do it, but we should stop doing it. Okay, these two stories have to do with pharmacists, okay? The first pharmacist story, one of my patients was trying to find Percocet, because this is the medication that works best. I find I understand it very well, and it works excellent for controlling hemorrhoid pain. And this patient was searching for it because there's a shortage right now. So they're calling pharmacy to pharmacy, and this one pharmacist tells her they're out of stock, but then starts to give unsolicited advice that's just not necessary to hear. They've said, you don't really need Percocet, you could just use ibuprofen. And the patient got really offended and really upset, because she's actually a clinician herself, and so she's quite aware of what I'm trying to do for her in her recovery. And she got upset and started arguing back, and the pharmacist started going back and forth. And when I heard that story, I was like, what are we doing here? Like, the patient's looking for pain medication, and you think that ibuprofen is good enough? And why are you arguing with a patient about this? Like, what does that do for you? It just blew my mind, not because of amazement, but because of rage and anger. Like, how have you even been through anything on your bottom end before? Like, when I ask patients, would you rather go through another hemorrhoid surgery or childbirth? They said, I'd rather go through and give birth to triplets, okay? And that's the God honest truth. And this pharmacist thinks that ibuprofen is good enough. And like, I don't know, who knows? Maybe some ultra meditation, cold ice baths. I mean, who the frick knows? And then the second pharmacy story that I have, again, I'm sorry if you're a pharmacist. Hopefully you don't practice this way. But this other one, I was trying to prescribe Percocet for severe anal spasms. This person was living in her bathtub, okay? And this person is trying to argue with me, what basis do you have, Dr. Chung, of prescribing this medication, okay? Tell me the data. Tell me why are you prescribing it? And she's holding this medication ransom from me as if she has the MD degree. I was like, man, if you feel that you have the privilege to do that, you need to go to medical school. I'm sorry, but you don't have the right to ask me those questions. You can certainly ask me a question, but now you can't withhold that medication because that's what she wanted to do. She didn't want to grant my patient to get that medication and follow through with my prescription order. It, again, blew my mind, put me in such a rage that this person, I understand if you don't know anything about the condition, but don't argue with me about it. Don't pretend like you understand anything what I'm talking about, or especially what the patient is going through here. And oh my God, that ruined my day, to be honest with you. And again, not to rag on pharmacists, it's nurses, it's GI doctors, it's family doctors, a ton of people and surgeons do the exact same thing. Downplay the pain and the suffering that bottom end conditions can cause. Everyone's afraid about addiction and abuse of these medications. Yeah, it's a real thing. But has anyone tried to really educate the patient, follow through, follow up, call the patient, make sure that they are doing things right and correctly? No one does it. But I do, because it's freaking important. That's how you get people off of these medications. That is how you treat the patient in a holistic sense here, okay? And so, I need a beer right now, but I just wanted to share that, put a little bit of a rant out there, kind of let you guys know what I'm thinking and what challenges I face to help, even to just help people. It's crazy in this environment. And again, it's not like I'm the angel here and everyone is against us. It's not that at all, but I've got to tell you, it has to be some understanding, some give and take in this whole thing here. But anyway, I hope you're doing the best that you can, and yeah, I'll see you in the next one. You take care. Bye-bye.